This segment sponsored by Viking Psychiatry. It's time for another edition of Mental Health Matters with Viking Psychiatry, and I'm so excited to be joined by their owner, Sean Goddard. Hi, Sean.
Hey.
Welcome, welcome.
Thank you.
Okay, so this topic is so important, so young men, listen up. We're going to be talking about low testosterone and how that can impact the mental health of young men.
Absolutely.
But Sean, let's just start at the basics. In case someone is unaware, what exactly is testosterone when it comes to men, and how does it impact their mental health?
Yeah, so testosterone is we could call it our main sex hormone, right? Mm-hmm. It's responsible for a lot of processes in our body, as far as most people are, think about it when it comes to sex drive and sex development, characteristics and that type of stuff. Mm-hmm. But it's heavily involved in metabolism, our brain function, and plays a significant role in also mood when it comes to our body. It's just like estrogen in women, right? And believe it or not, women also have testosterone levels, and that plays an important role with women as well. Right. But today we're going to focus, of course, on testosterone, and especially that in young men. So
yeah, okay. So reports out show that low testosterone is happening more frequently when it comes to young men. Yes. And so first off, what are the stats, and why do you think this is happening?
There's a lot of differentiation there, whether it has to do with sedentary lifestyle is one big question, because we spend a lot more time indoors, we spend a lot more time sitting down, not moving, and we do know that exercise and movement is very important in that. We also look at environmental factors, potential long-term exposure to our parents, our grandparents, and genetic factors that have passed down from that, whether there's any correlation between hormones that have been used in foods and, for example, in animals and those types of things. But it's really something that hasn't gotten enough focus yet as to how prevalent it is becoming in younger men.
Yeah, and you had mentioned that when you are working with these men, they're looking for a solution to what their issues may be, and you would run the test and learn that they are low in testosterone, and you say that the levels are close to older men, which is wild.
Yeah, absolutely. When we see low testosterone, a young man could potentially have no change in his sex drive whatsoever, but also have low motivation, low energy, problems with cognition, memory. It doesn't always present. People think that it just has to do in correlation with the plumbing, is what I often say, but it doesn't always present that way. I have had men that come into my office, young men that come into my office that have the sex drive of a young man, but can barely have the energy to get off the couch and participate in life, and have gone and seen their, potentially their primary care doctor or other psychiatric providers, and told that they're treatment-resistant depression, or, really not necessarily always putting the finger on the pulse of what's going on. And then we run these levels on these men, and we get levels back that either are significantly low in the 100s, low 200s, or maybe they're coming in at 350, which is kind of borderline when you run the labs, depending on the lab. 350 to 1,000 to 1,100 is considered normal, and they'll tell them, oh, your normal is just low normal, and expect that to be acceptable. But young men in their early 20s, their testosterone level should be 850, 900, 950, 1,000, 1,100. So if you're walking around with a testosterone level of 250, that's going to have a significant impact in you in some way. And what we often see being missed is when it's affecting them, and that kind of presents with those mental health type presentations as just being assigned as some type of mental health concern, as depression, and then not responding to medication, right? Because the problem isn't necessarily the depression, right? It's that low testosterone that is driving the symptoms that appear to be depressive symptoms.
That's deep. That's really deep. And I love that the more that we're learning about medicine and science and just how the body works, so much is being revealed, because hormones play such a big part in the way that we function, what our body's made up. of and what we may be lacking. And I think that you hit on something so important with our numbers. When we're getting back reports and blood tests and all this kind of stuff, is we have to be advocates for ourselves and also find other alternative solutions, not just solely focus on medicine, not just solely focus on doctors, but a more holistic approach. Because as you said, your focus is the whole body, right? Healing the whole body. So I love this approach. So what are some of the signs that mental health is impacted? I know that you mentioned signs of depression and things like that. But what are some of the major signs, and how can people really start to heal from this?
Yeah, so, besides the trouble concentrating, right, the low energy, low motivation, you can have reduced muscle mass, reduced drive. There's an inability to bounce back. You can have difficulty in sleep. There's a lot that can present with low testosterone. The other problem that we deal with in young men is, even if we do catch it, and many times it's not caught, and then we do catch it in our office, is if you look at treating that low testosterone, for example, with supplementation, you impede the production of their ability to produce, or their fertility. And so when you're artificially treating with testosterone, that can impede that and take away their ability to be able to have children. So it can be this very fine balance on what do we do? Do we treat? How do we treat it? And is it through the use of testosterone, or is it looking at other potential factors, such as increasing exercise, right? Looking at different vitamins that are in play there. If their testosterone level is high, but maybe they're beginning to gain weight, and they see that they gain it in their chest. We look for our mood instability. That can be a sign that we actually end up having high estrogen levels, right? And so then looking at that, running estrogen levels and treating that naturally to begin to reduce those estrogen levels, allowing you some more stability and ability to also increase those testosterone levels. So you really have to look at the total picture of the individual and what's going on. And many times it's a combination of both, right?
Yeah.
We can have men who are struggling with depression, but also have low testosterone, and that depression often won't get to where it needs to be, an improvement, because that low testosterone is not being addressed.
Right. And what are lifestyle changes that a young man can make to help with his low testosterone and also improve his mental health?
Yeah, so we look at dietary intake, right? Reducing sugars and fats, and increasing proteins, also increasing, just getting our daily supplementation.
Yeah.
Are we eating the right amount of vegetables? There are vegetables that can help with production, right? We especially look at like green leafy vegetables and those types of things, but also taking a multivitamin, making sure that we're getting adequate omega-3s in our diet. And if we're not getting that naturally, how many of us are eating salmon and fish multiple times a week, right? It's just not happening, right? So weightlifting and those types of things can be very beneficial, but just getting off the couch and moving. But sometimes that can be very hard for people to do that because their testosterone is low. And so we often do find that just treating with just exercise or just food changes, especially at the beginning, can sometimes be difficult because we need that little extra boost to be able to help us have the energy and the motivation that's being drugged down by the low testosterone. So we can look at natural supplements as well as testosterone supplementation for those individuals. But sometimes it can be hard because some providers don't want to treat it because they are young men, and the fertility issue. So it's really finding a good balance.
Yeah, it's a fine line for sure. Thank you so much, Sean.
Absolutely.
Very informative to learn that it may not just be laziness or just lack of ambition. It could be other things that's happening in your body. So it's so important to get it tested and to learn. And the best place to go is Viking Psychiatry. So we will put their website below to learn more. And I look forward to seeing you after the break.
This segment sponsored by Viking Psychiatry.